Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. But for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com, we're glad that you all could be with us. Also, just joining us through our friends at iHeartRadio and Amazon Music Podcast. We're glad you all could be with us as well. Well, as this year is coming to an end, a lot of us are still playing catch-up because of the last 18 or 19 months, and that includes the millions of people who need to catch up on their medical testing. Here to talk to you all about the importance of that, especially when it comes to gastro testing. We're excited to welcome Dr. Edward Brettholz to our program. He's a specialist at Vanguard Gastroenterology in New York. We'll talk to him not only about what you all need to know about gastro testing, but also where you all can go for some more information as well. Dr. Brettholz, thank you so much for the time. Really appreciate it.
Great, Cyrus. Thank you for having me here. I really appreciate it.
Well, we're glad to be able to share this information for our radio audience. As I mentioned, though, many people are playing catch-up, Dr. Brettholz. Why did millions stop their medical testing when COVID hit?
Well, as you know, and as everyone knows in the world, when COVID hit, it was devastating. People would not leave their homes. They wouldn't visit with their children, their sisters, brothers, parents. They wouldn't even go to the supermarket. And they certainly wouldn't go to their doctors if it was just for a screening colonoscopy. So I think that was the big issue, not wanting to leave their house and not wanting to be at the doctor's office. In fact, many doctor's offices were closed for a few weeks.
Yeah. Yes, such a great point. I know from my father, Dr. Brettholz, we actually had to do mostly telehealth for him last year, but they did allow him to go in for his colonoscopy last year. So we were fortunate about that. I want to talk about gastro testing, and I think this is one of the things we don't always think about. What makes it so important?
Well, the reason why it's so important that patients went in for their colonoscopy screening is because it prevents colon cancers from occurring. When we talk about screening tests, screening colonoscopies, we're not talking about patients with symptoms, bleeding, abdominal pain, weight loss, etc. We're talking about totally preventive medicine in healthy people. And we know that there are precancerous lesions found in the colon. They're called polyps, and they're benign. And we know that over time, they can turn into cancer. So what we try and do is do a 15-minute colonoscopy on a patient, look for these lesions and take them out. And by doing so, we can prevent cancer from occurring. And unfortunately, since patients didn't go during this year or two during the COVID pandemic, we're actually seeing less colon polyps and less colon cancers because there haven't been so many procedures done. And now that the pandemic is actually easing up a little bit and people are going back to their doctors and getting their screening tests, we're seeing a lot more colon cancers and polyps. And unfortunately, some of these, I'm worried, will be at a slightly later stage than they would have been if we picked it up 2 years ago.
Well, and that really is why conversations like this are so important. So as people are listening to this, then, Dr. Brettholz, what actions should they take when it comes to making sure that they are getting that top gastro health?
Right. So they absolutely need to speak to their physicians to see if they are due for a colonoscopy. And the guidelines have changed. Previous to a few months ago, we used to start screening, again, the preventative colonoscopies in patients who were 50 years or older. We'd start at age 50. Now we know that even if you're between 45 and 50, you have an increased risk of colon cancer. So we start the screening now at age 45. So if you're 45 or older and you haven't had a colonoscopy, call your doctor and discuss it with him because you should probably be scheduled for one.
All right, so that's good information, including for myself. So let's talk about then care options then. I mean, a lot of advancements have been happening. We've seen it in recent years. Is there any new care options that are available that our audience should know about?
There's so many exciting things going. I don't even know where to begin, but I just want to mention a few that I think have been super important. The microbiome, the good bacteria in the gut. That we know that the bacteria are associated with different diseases, but we also know that some of the bacteria can help cure diseases. And let me give you an example. There's something called C. difficile, Clostridia difficile, and it causes severe diarrhea to bacteria, and it's very hard to treat, and sometimes it's deadly. And now we know that you can do what's called fecal transplants. You can take feces and good bacteria from a healthy person and put it into the colon of a patient who has C. difficile, and it can actually cure the disease.
Wow.
Some of the other exciting things are there's something called a video capsule endoscopy on the market. The upper endoscope can look in the stomach, and the colonoscope looks in the colon, but there's about 15 feet or so of small intestine that we cannot reach with our scopes. So this pill that people can swallow has a camera in it, a light in it, and a battery in it, and it takes thousands of pictures as it goes through your body. And those pictures are transmitted wirelessly to a little box, a little packet that you wear on your belt, and then the doctor looks at thousands of pictures. There's also artificial intelligence, which is being used now on our colonoscopes. Sometimes we miss these tiny little polyps, but with this artificial intelligence, the computer can find these polyps that we might have otherwise missed. And just lastly, I should mention that we're doing things with our scopes, our endoscopes and colonoscopes that we never used to do, things that only surgeons would do. If a mass or a tumor had to be taken out of the GI tract, surgeon would cut open the person, but now we know we can do this through our colonoscopes, do a lot of surgery through the colonoscopy, with a colonoscopy and an endoscopy. And if there's a big hole or a gap that's left in the GI tract, we can use an endoscopic sewing machine, or we can use clips to close it. So we have a lot of exciting things now, and a lot of new things that are developing and on the horizon.
A lot of great information. Again, another reason why Dr. Brettholz, our audience, should go out there and make sure that they're getting caught up then on their medical checkups as well. Where can our audience go for more information?
They can look up the American College of Gastroenterology, specifically for the guidelines, and also another good place for the latest guidelines, the U.S. Preventative Service Task Force, and they talk about the guidelines starting at 45 years of age for the preventative screening test. And if you're in New York and you want to come by to Vanguard Gastroenterology, you can come by or give us a call. We'll be happy to help you out.
All right. Thank you again, Dr. Brettholz, for the information. Really appreciate it, and looking forward to having you back on the program again.
Thank you, Cyrus, and stay safe.
Thank you, you as well. And we thank your audience for tuning in to another great segment of Conversations Live, part of our News You Can Use segment here at WYAD 94.1 FM and WYADonline.com. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.